Hi, my name is Llewellyn. I'm a certified manual lymphatic drainage therapist, and this video is a step-by-step tutorial on how to dry brush. So our intention with the dry brush is to move lymph. We're going to be brushing the brush across our skin, and this is going to affect the superficial lymphatic vessels that live just underneath the first layer of the skin. The dry brush is super nice because it's easy to use a light pressure that you need with lymphatic drainage. The first thing we're going to do before we dry brush is actually set the dry brush down and use our hands. We're going to use our hands to open up the big six, or the 6 areas of lymph node clusters throughout our body. That's our neck, behind the ears, in our armpit, the abdomen, the groin, and behind the knee. Go ahead and take your 2 hands, cup over the nape of your neck. Action is going to be pulling down. I like to use my elbows as sort of a guide. And we're really just creating a pumping action at the nape of the neck. We're aiming for the terminus of the lymphatic system, or the place where the lymphatic system empties clean fluid back into circulation. We always want to start at the neck with manual lymphatic drainage because we're essentially clearing the off-ramp of the lymphatic highway before we start to move any fluid. This way we know that the fluid has somewhere to go once we start moving it all. So we're just going to do about 10 pumps here, and then just take your hands and make just some gentle light circles. You can see I'm not really pressing hard into the skin, just aiming to affect those lymph nodes. We're going to go behind the ears. Option to have right hand on right side, left hand on left side, or if it's easier, you can cross your hands. Just want to make sure that we can get full skin contact. So we're just going to move our hands across the skin. Action is pulling down like this towards the terminus. So really just pressing gently into the sides of the neck, getting a little bit of skin movement, not too much pressure. And again, you can do same hand, same side if that feels easier for you. We'll do about 10 little pulls down on the skin, and then take fingertips and just gently tap behind the ears. Let's work the armpits. So you'll take right hand to left armpit and just engage into the armpit with your right hand. These lymph nodes are a little bit more embedded in tissue, so you can stand to use a little bit more pressure, but still we're not really digging in. We're just aiming to move that tissue around the lymph nodes to start to get some fluid to move. So just about 10 repetitions, opening up the left armpit. And then after about 10 repetitions, take a light fist and just make some circles on the front of the chest and on the shoulder. If we think about our body as a body of water, fluid movement anywhere means fluid movement everywhere. So we're really opening up these lymph nodes so that we can move that fluid. Now other side, hand goes in the armpit, and just engage into that armpit towards the body about 10 times. Light pressure, just aiming to stretch the skin, maybe a little bit of tissue engagement, just sort of shaking up those lymph nodes and making sure that things can move through, so that when we move the fluid with the dry brush, the fluid has a place to go. And then light fist, just rubbing on the front side of the shoulder and the chest. And now let's work the abdomen. So with the abdomen, we're going to find the place right between the 2 rib cages, just underneath the diaphragm. I like to stack my hands and just engage in and up gently. This is the largest lymph node of our body. It's called the cisterna chyli. Any lymph fluid that moves from the lower extremity to the upper extremity needs to pass through this area, so it's very important in the lymphatic world. Just engaging about 10 times up. You can pair this movement with deep breaths because breath is a major lymphatic mover. And then you're going to take the hands and just rub all over the abdomen. Just get some fluid moving in there. Nothing too precise, honestly, just shaking the hands around the abdomen, getting a little bit of tissue engagement. Next, the groin, we can do 2 hands at once. Hands go in the hip creases and just make some circles with your hands. You maybe even palpate or feel these lymph nodes. If you can't, that's totally fine. Some people can feel their lymph nodes easier than others. Sometimes a lymph node or 2 may be a little bit more swollen, depending on what's going on in the system. So just notice if you can feel lymph nodes. It's no big deal if you can or can't. So just rubbing the whole groin, hip crease area. Then we're going to take gentle fist and just tap away at the hip crease, being sure to hit the inner thighs a little bit as well. And then lastly, the knee pit. So I'm just going to put my foot here on a bench so you can see. Just going to engage in and up towards the hips from the bottom of the knee. action is like this. Just rubbing behind that knee a little bit, making sure that we can get fluid through. And then we'll tap behind the knee, just going about 10 times in each spot. Same thing on the other side, engaging up and towards the head, up and towards the hips. We'll just go about 10 times. And then tap behind. Okay, so now we've opened up all the areas of major lymph nodes. This is essential for dry brushing because we want to clear the pathway that lymph is taking before we start to move it. Now that we've opened up all the pathways, we know that fluid has somewhere to go, and now we can begin our dry brush. Start our dry brush from top to bottom, starting at the neck. So I like to take my dry brush and just start with little light strokes down the neck towards the terminus. Don't have to stay at any place for too long, maybe about 10 to 15 strokes. And then same thing on the other side. See those gentle strokes. Like I said, dry brushing is really nice because it really keeps you true to that light pressure that we need for lymphatic drainage. Next, we're going to move across the chest. So we have a line down the center of our body that delineates flow. So anything on the right side drains to right lymph nodes, anything on the left side drains to left lymph nodes. So you're going to take the dry brush and act in accordance with those watersheds. So starting from your center line, just making little light brush strokes from the center out. We'll do about 3 to 5 passes. I'll do 5 to be thorough in this video. Just moving that fluid across the chest. This is great for breast health. And then same thing on the other side, starting at the center line, little brush strokes out and finishing all the way out to the shoulder. So we're going to dry brush in the same sequence that we did our big 6. So we'll start at the neck, we'll work the armpit area and the arms, the abdomen, and then the legs. So next, dry brush towards the axillary nodes. So you're just going to start with brushes up on your flank towards your armpit. We'll go about 10 times. And then the upper arm, little strokes, starting towards the armpit and then moving away from the armpit. All strokes are moving towards the body. Important to remember that when you're dry brushing, all strokes are going to be moving towards a set of lymph nodes. Oftentimes that's towards the heart or the terminus. So now we've done the back side of the arm, and we'll just keep working the upper arm with little strokes starting closest to the armpit, working down the upper arm. So I usually do about 3 to 4 passes on my upper arm, aiming in the direction of the armpit. A little set of lymph nodes in our elbow pit as well. So I like to just spend a little bit extra time on that elbow pit, the antecubital space if we're getting anatomical. And then we'll do that same thing that we did with the upper arm on the lower arm. So just starting from the inside, working from the elbow, then down to the wrist in little strokes, and then changing that pathway so that you're maybe just one dry brush print over, starting from the elbow, and then working all the way down the hand, moving one print over, working from the elbow and then down the arm, and then finally one print over, starting at the elbow and moving down the arm. And then let's just do a few long strokes up the arm and switch. So starting on the other side at the flank, towards the armpit, about 10 strokes. And then at the upper arm, starting closest to the armpit, strokes are moving towards the armpit, and dry brush slowly moves away towards the elbow. And then we'll just work the upper arm, moving one print over, starting from the armpit, go towards, starting at the armpit, go towards the armpit with your stroke and down towards the elbow, and then one print over. Then antecubital space, the elbow pit, just a few strokes here, really targeting those lymph nodes that live in the elbow. And then we'll work down the forearm, starting closest to the elbow pit. Strokes move towards the armpit, and we're working down towards the wrist. Then back up to the elbow, one dry brush print over, starting at the elbow, brushing up in little strokes. One print over, up, 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 up in little strokes, and then finally that pinky side. We have lots of lymph on the top of the hand, so it's always a good idea to hit that top of the hand, whether you hit that top of the hand as a continuation of the stroke from the forearm or the hand on its own. Either way is fine. And then we'll finish with a few long strokes all the way up the arm. Our watershed for the abdomen starts at the waistline, so we're going to start at the waistline and move down towards the inguinal nodes. Anything above the waistline will drain towards the upper nodes. So we can start dry brushing up above the waist, so rib cage and belly button, just up towards the waist. You can even hit the back if you can reach it, starting above the belly button. Anything above the belly button moving up, 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 up towards the armpit. And even hitting that back if you can. Then below the belly button, we're going to work down, so strokes down towards those inguinal nodes, because that's where fluid is draining on the lower half of our body. So you can even hit the back, just brush down. Now all the fluid from the back does drain actually to the front of the nodes. So if it is accessible for you to reach the back, you can finish the abdomen with some strokes from the back to the front, like so. And then getting that area below the belly button to drain towards the inguinals. Same thing on the other side. Back to front, back to front. And then continuing that stroke below the belly button towards the inguinal nodes. Okay, there's the abdomen. You can spend as much time there as you want. So I got a bench here to put my foot on so you can see it. You can also just do this sitting down on a chair, on the floor, whatever works for you. I'm putting my foot up on a bench so that you can see, but I really encourage you to find what works for you and what feels comfortable in your body. So starting from the legs, we already opened up the lymph nodes at the groin. So we're going to be working the thigh, all strokes moving up the thigh towards the groin. So just like we started towards the armpit, we're going to start closest to the groin with strokes going towards the groin and working our way down. So find a place to start at the inner thigh and just do little strokes up towards the body, the inner thigh. Then we're gonna go one brush print down. Those little strokes moving towards the groin and moving down towards the knee. And let's just finish that up with a few strokes on the inner thigh, and then we'll work the top of the thigh. So all strokes are going towards the set of lymph nodes that we're draining to. So this would be the groin lymph nodes, or the inguinal lymph nodes in this case. Starting closest to the groin and working down in a line, and then finding another dry print over, starting closest to the hip crease and working down. Eventually we're going to work all around the entire thigh. The entire idea with lymphatic drainage is that we're clearing the pathway. So we wouldn't want to start at the end of the limb and push fluid up, because then we would be jamming up the lymph system. We want to be really cognizant of where the lymph is coming from and where it's going to, and making sure that we clear out the pathways so that that lymph has a place to go. So let's dry brush around the knee. You can even dry brush behind the knee to sort of freshen up those popliteal or knee pit lymph nodes. And then you can just do a pass moving around the knee, just affecting any of that lymph that may be chilling in the knee space. And then working down the leg, same idea, just choosing one path to go down and using strokes towards the body as we move down that pathway. And then finding one print over, brushing up towards the body, and even continuing that stroke on the top of the foot. And we're just going to work all around the lower leg with strokes up, 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 up. Fluid does tend to pool at the lower extremities, especially in the ankles. You might notice swollen ankles. So dry brushing is especially helpful for any of that swelling. So let's finish up with big strokes all the way from the ankle up to the groin, moving all around the leg to just seal the practice of this side. And saying goodbye to this leg. And then finally we'll work the other side. Starting closest to the groin at the mid-thigh, brush strokes are moving towards the body, and we're just going down one line, moving towards the knee with brush strokes up, and then moving one print down, brush strokes up towards the body. Now I got the mid-thigh. Now let's work the top of the thigh, starting with strokes up near the hip and working down the leg towards the knee. You can see as you're watching yourself dry brush that we're getting a little bit of a skin pull. That's really what we're aiming for with lymphatic drainage, is to get a skin pull so that we can really affect those superficial lymphatic vessels. And then finally working the back of the leg. It can be a little awkward to hit these spots sometimes, but you got it. Starting closest to the hip, working down, and then we can brush up on that popliteal knee space, and then just hitting all around the knee, shaking up any fluid that may be in all of those crevices of the knee. And then lastly, working down the lower leg, choosing one path to go down and using brush strokes up towards the body. Going one print over, brushing up, moving down. On the leg, usually you'll get 5 or 6 passes over the lower leg. Ending with the back on the calf, starting at the knee and working up. And making sure that you get the top of that foot. And then finishing up with big strokes all the way up the leg. Alright, so now we've dry brushed the whole body. Thanks for going along that sequence with me. The dry brush is really great for clearing up any superficial lymphatic issues. It's a really great tool in your toolbox for your lymphatic health and your general self-care overall. This was really focused on lymphatically oriented dry brushing, so I hope this helped. Share it with a friend if it did, and I'll see you next time.